Welcome to the Fibromyalgia Podcast. I'm Tami Stacklehouse, fibromyalgia coach, author, and founder of the International Fibromyalgia Coaching Institute. The goal of this podcast is to empower you with access to the dream team of experts and coaches I've discovered are key to living the fibro life you love. From the comfort of your own home, and maybe even your pajamas, I'll help you take back control of your life and health. To help out with fibro fog, I always include full show notes and additional resources at fibromyalgiapodcast.com. Welcome to the Fibromyalgia Podcast. I'm your coach, Tami Stacklehouse, and this is episode 162. In today's episode, we dive deep into the world of pelvic health with Dr. Desiree Cassell, an expert pelvic floor physical therapist. We'll discover the truth about why issues with the pelvic floor might occur after life events like childbirth, surgery, or trauma, and we'll debunk the myth that these are just normal, quote-unquote, normal problems. Dr. Desiree is also going to shed some light on the fascinating connection between the pelvic floor and both physical and emotional trauma, and why pelvic floor dysfunction can contribute to everything from leaking, like you might expect, but also knee and hip pain, and even, get this was the one that blew my mind, TMJ issues. Yes. Your pelvic floor can cause issues with your jaw. What? So let's get to it. Our guest today is Dr. Desiree Cassell, a doctor of physical therapy specializing in women's pelvic health. She is the host of the Pelvic Floor, Core, and More podcast, founder of the Pelvic Floor, Core, and More app, and owner in PT at the Balanced Momtality Women's Health and Wellness, where she coaches women in person in her home state of New Mexico, as well as virtually all over the world. She is a foodie, lover of all things movement and nature, and a mom to 3 energetic and active kids. After her first pregnancy, she suffered with her own pelvic floor dysfunction, and like many, she just accepted it as part of being a new mom. Sadly, that meant no more jumping on trampolines and crossing her legs fiercely every time she sneezed or laughed so she wouldn't pee herself. But after PT school, when she got pregnant with her second child, she was determined to put her knowledge to the test and was able to completely resolve her issues even while she was pregnant. This led her to her passion in educating, empowering, and supporting other women throughout their lifespan so that they didn't have to accept these common issues as part of life. Dr. Desiree uses a holistic whole-body approach to helping women heal their bodies and stay balanced throughout all stages of life, starting at the core. Now, as always, I need to remind you, the information included in this podcast is never meant to be considered medical advice, and it is not intended to replace consulting with a qualified physician or other healthcare provider. In fact, Dr. Desiree specifically talks about that in this episode, why it's important to have an actual face-to-face exam with a pelvic floor PT. We hope that what you learn here, you will take and talk it over with your providers. I'll also add that, seeking out a specialized pelvic floor PT can be life-changing for many women experiencing pelvic floor issues. And I've seen this with my clients. If you are in New Mexico, be sure to check out Dr. Desiree's clinic. And as I said earlier, she does do virtual coaching around the world. If you're outside her area, you can use the tips that she shares in this episode to find your own pelvic floor PT, because that in-person exam is really important. Now, let's dive in. Hi, Dr. Desiree. Welcome to the Fibromyalgia Podcast.
Yes, thank you so much for having me. Excited to be here.
Yeah, I am so excited to talk to you. Now, for you listening, we just did a podcast swap, so I was just on her show. So make sure you check that out. But today, I want to talk about all that pelvic floor stuff. And I think a great place to start would be, what is a pelvic floor PT? Because it isn't like your typical PT, right? It is a little bit special.
Yeah, no, I think that's a great place to start. We are definitely not just typical traditional orthopedic PTs. Although I'll say most pelvic PTs have some orthopedic background. Like myself, I stumbled into pelvic floor PT, one from having some of my own issues and learning some of that through school and putting it to the test. But even still, I was really adamant about wanting to be at an outpatient ortho clinic and working there, and they needed a women's health. And so I ended up being their women's health there and going through the courses, that continuing specialty courses to really have that knowledge. Because in PT school, we are, if you're lucky, not even all PT schools, I mean, hopefully this is changing, but when I went through school back in 2015, not all the schools even had what we called gender health class. So it wasn't even pelvic floor class or women's health class. It was gender health because obviously, as a culture, we are trying to be all inclusive. So, a lot of terms, even of other pelvic floor PTs, could be gender health PT or pelvic floor PT, or I do like to call myself a women's health PT just because I do personally specialize in women. I do not treat men. I do treat men externally and I do look at the whole body that way, but I'm not doing any internal or even external observation of the pelvic floor with a male for various reasons. I'm in my own little clinic office myself. I'm a solo practitioner. I didn't really feel necessarily safe seeing everybody being trapped in a room by myself. And, I was kind of like, well, I'm just getting comfortable with vaginas. I think I'll stick with that one. And I think women are very underserved. So I felt like, you know what? I don't need to be all inclusive here. So I am just real niched into women and our pelvic floors. But yes, every person does have a pelvic floor that can cause dysfunction. Men can have issues with that. And so there are resources for them. And I just refer to those PTs that treat that. But yeah, pelvic PT, and also differentiating because some people, unfortunately, even in my own community, kind of claim to do pelvic PT, but never once do an internal assessment. So that's kind of a big differentiating piece for me. Does that therapist have the skills to internally check that pelvic floor function and muscle tone and organ position and all of those pieces? Because yes, you can treat the pelvis externally in an orthopedic fashion and call it pelvic floor, but it's not. So I do think there is a big differentiation there, and it's good to know that because I'll have women come saying they've done pelvic floor PT and come to find they just did Kegels because their PT told them to do Kegels. And that's definitely not pelvic floor PT.
No, no, it's not. And I've had clients who have had pelvic floor PT and have found it very helpful. Trigger points where you never thought you could even have a trigger point.
Exactly.
So I know that there is someone listening right now who is like, hold up a minute. What is this internal, excuse
Yep.
me, that sounds like my dreaded annual exam.
Yep.
So let's talk
Exactly.
about that.
Even when people find me and they come to me and then I'm like, yeah. And so then we'll do the internal assessment and they're like,
Excuse
wait.
me.
They're like, I didn't know what I was getting myself into here. But I'm like, come on, like this is just a part of our body and we need to kind of break down the stigma around it. It is a muscle and we can't treat that muscle without touching it. Like we do need to see, and I mean, we can. I do telehealth coaching, like we can affect those muscles, but also let's be honest, in those coaching sessions, I'm teaching women how to assess their own vagina. Like we're not touching it. Like we're at least looking at it, like we're trying to reconnect to that space. And it isn't for everyone. I will say they are so beneficial. It's information I think every woman should know, especially if you're pregnant or postpartum or ever had kids or an abdominal surgery, and we'll get into all the things that pelvic floor dysfunction can cause. But that's why I think it's good. Just like, I'm a big advocate for even just having an annual PT assessment just to know, am I losing shoulder mobility? Am I losing hip strength? Like, can I be proactive? about some of these other pieces in my body before I have a rotator cuff tear and things like that. So even with pelvic floor PT, especially, we want to know the status of what things, how they're functioning. Are we getting some organ descent and prolapse that we need to watch and monitor before we have symptoms? Are we starting to get some tension internally without having pain yet that we can get on top of? So I do think everyone should get one because it does tell us a lot more than we're ever being told about our pelvic floor. Even if you're going to get a pap smear or you're going to that 6-week postpartum checkup and you're even getting an internal assessment, which unfortunately, let's be honest, these days, a lot of women aren't even getting that internal check at a 6-week postpartum visit. And they're just being told, you're good to go exercise, you're all cleared. But even if you're coming in with reports of leaking or pain, if they go internally and they're not finding a bunch of abnormal tissue cells or obvious pelvic organ anatomy changes or very obvious tissue tightness, they're just like, I don't know, all seems good to me. And maybe they'll run an ultrasound, maybe you'll get some assessments done, and then they say, yep, all's normal. And then they come to me and they're frustrated because they're like, no one is taking my pain seriously, or they had leaking and they told them to just do Kegels. I think that if your provider is referring you to pelvic floor PT, that is a great sign because they see the benefit of it. But even then, a lot of them just think we do Kegels, like teaching people how to do Kegels. And that is probably the last thing I do. And so it is just even educating, the women, the community, and also providers that really this is information we should all be aware of because internally, I'm checking strength on both sides. You can have a weakness side to side. I'm checking muscle endurance. How long can it hold? I'm checking, can it relax and open up, which is just as important as its ability to contract and support. And then we're checking prolapse, pressure management. How are you engaging your brace? Does it change pelvic floor pressure when you engage your brace? Does your pelvic floor lift and start that brace like it should? Are we getting that whole core canister system to work together? Is that pressure management working? Do we have trigger points, fascial restrictions? Is there some pelvic organ prolapse contributing? And that's just internal, right? So there is a lot that we're looking at, but that internal piece is really crucial because even women that I've had come to me with back pain, hip pain, no actual pelvic floor issues like leaking and some of these obvious things. And they're like, I've done PT, like my hip still hurts, like it got better, but it's not great yet. And then I go internal and we do have a hip muscle as part of the wall in our pelvic floor. And that muscle's real pissed off. And it's like, well, no wonder you've been having hip pain and no one's been able to get to it because it's an internal muscle. And same thing with back pain. Those muscles connect that whole pelvic outlet. And so we have connections to the sit bones, the pubic bone in the front, the tailbone and the sacrum in the back. And that tension, if there's any tension and it yanks on that sacrum bone, it changes the posture the whole way up the spine, which is why even back pain, neck pain, TMJ, shoulder issues, they can all be coming from pelvic floor. And then with that hip piece, we can also see knee and foot issues. So again, being orthopedic minded, but having a pelvic floor specialty myself, I do treat the pelvic girdle, but I'm looking at that system as a whole. And I would say that's another thing to look out for when you're looking for a pelvic floor PT, because even if they're doing internal, some pelvic floor PTs are still very isolated and only treat that pelvic piece. And I think that it's helpful to have someone who's looking above and below that to really connect all of those patterns and connections and finding those imbalances. But that internal assessment, while it's no one's favorite part, it is also the thing that people leave going, oh my gosh, why didn't I get that done sooner? And especially if you have pain with pap smears or those internal assessments, it's like, well, that's why I'm coming to you. I have pain. Like, I don't want to do that. Sometimes we don't do it right away. Sometimes it's not appropriate. And I am never there to cause more trauma to the body. We definitely want to honor the body And when it's ready, we'll do that internal piece. And sometimes that takes time. Sometimes the body is never ready, but more often than not, the body is ready, the brain's ready. It's like, okay, let's do this. And then afterwards, they're like, that was the least painful assessment I've ever had. Because if you're getting a conscious PT in there, trauma informed, making sure like one finger, this is not a speculum assessment. This is all to tolerance. We're not just in there poking and prodding. Like, yes, there's some like, what do you feel here? What do you feel here? But if we're seeing the face scrunch, if you're coming off the table, if you're saying ow, like that's too much. Like it should be something that's like, oh, that's uncomfortable. That's different, but you can relax into it. So we definitely don't want to encourage just doing it to do it. I will have women come in and say, let's do it. And I can tell based off their history of trauma and the way their body is presenting, their body is not about it. Like their brain is saying, I want this information, but their body's like, nope.
Mm-mm.
And unfortunately, I'll say, no, like we're not doing this today because even though your brain is ready, I can tell your body's not. And it's not going to be productive because the pelvic floor is going to be really, really tight. It's going to be very painful to do it versus waiting for the body and the mind to be on that same page. So, long answer, but yes, I think that that internal assessment is so, so helpful and can tell us so much.
Yes, definitely. And with that too, I mean, obviously, you need to have a therapist you trust, right? I mean, that's a pretty intimate, I mean,
Yes.
so how would somebody go about finding somebody that they could trust? What would we be looking for on a website? What questions would we ask? How would we know this is the right person? I mean, obviously, you got vibe too to know if do I even like this person? Do I want them that close to me? But from a educational perspective, what are we looking for? What questions should we be asking?
I mean, if you are concerned in any way, I think asking if they're trauma informed, that it helps because normally that does give some insight to some of their continuing ed classes and kind of how they approach stress and pain and trauma in the body. Because, well, traditional PT is kind of thought of as like pain and torture, right? So PT was like, oh, it stands for pain and torture. Like we're there to make you work and we don't care. And that is just not me. I like to call PT playtime. And it is something that we like, I am not a push through pain. It's we want to listen to the body. And I think just asking questions like that. And maybe if you're unsure, like go to the initial assessment and like you said, feel it out because I think the big clinical, like green flags of like, oh, let's schedule an appointment would be they're looking at the whole body, they're doing an internal assessment, and they sound nice on the phone, right? But you can't get much more out of that. You could ask trauma informed, but otherwise, like, you're not really going to know until you're in the space with that person. And I'll admit, I'm not for everybody. I will say it's only been one lady, but I've had one lady that was like, I don't know if you're going to do much for me. And I'll also say, yes, maybe that was my energy. But at the same time, as soon as she stepped in my door, I was like, I don't think we're going to work because I could tell the moment she walked in that she did not believe a word I said. Like she was just already had her own mind made up. And being a people pleaser, that really hit hard because I was trying to like, like just like me, like I can help you, I promise. And afterwards, I had this talk with my husband. He's like, that's someone you don't want to work with. Like, I was like, that's true. We're not meant for every person.
That's
And that's
right.
okay. I hope she found someone that helped her, although she was kind of the person who just wanted to dictate what was done to her and thought she knew all things. So, who's to say how her care is going? But I do think that there's something to be said about vibes, like you said, like just feeling it out on the phone, feeling it out in person, because it is very intimate and we get into all the TMIs. A lot of my patients are like, I don't know if this is TMI. Like in here, never. Like I even try to break the ice. I talk about my own poop and pee patterns. Like we do get deep into poop. We get into sex. We get into what position hurts. We get into how orgasm feels. Like there is a lot of intimacies there that again, I never thought I'd be talking to people about these things. And going through PT school, I was actually like, okay, wonder who'd want to do that job. And then getting into it myself, it was just such a rewarding side of PT where you're seeing all of these women that have been so underserved and written off. And then knowing the information I knew and seeing how life changing it was. Like, yes, PT in general is very rewarding. Getting people able to play sports, walk with their grandkids again, like go for the runs they love, walk upstairs, like those are big things. But then you have women who like haven't had sex for 10 years and their relationships going downhill. They have had debilitating urgency and incontinence where they can't even really leave the house because they're always planning where the bathrooms are going to be. And then you get these symptoms resolved, and it's like this whole other quality of life that they didn't even know existed because it's so foundational that we just assume that that's there. And for so many, it's not. And so, yeah, I think that we're not all created equal, and finding someone that has the skill set, but also does click with you. Because I end up, I say, being just as much or more of a mental health therapist as a physical therapist, especially with this population, just because, as we'll get into, emotions are stored in the pelvis. And so there is a lot and muscle holds memory, fascia holds memory. So even body workers in general, not even pelvic PTs, but PTs, massage therapists, like there is that emotional piece and mental piece. But I think being a PT, I have the luxury of time where I can talk that out with my patients a lot more than other providers do, which was a big reason I went into PT. I wanted to have that time and not just feel pressured to get people out the door. But yeah.
I think the thing that I'm kind of taken away from that is it's okay even to decide because you like somebody's picture. And then once you get into the office, then you can ask all the questions, make sure they have the knowledge and things like that. But this is a little bit different than choosing the person who's going to perform shoulder surgery.
Yep, definitely.
Yeah. So let's talk about some of those symptoms, right? So flipping it the other way, what might be some clues that pelvic floor therapy, PT like this would be helpful?
So I think some of the very obvious pelvic floor dysfunction symptoms, again, would be leaking. So incontinence. If you're leaking at any time, if it's not voluntary, that's incontinence, and that is an issue. And this is something that is not normal. You know, a lot of these symptoms are considered normal. I was even told by my provider, you had a kid, that's normal. My mom, oh yeah, I don't get on the trampoline because I've been peeing myself since I had you guys. Like, and it just gets normalized. But that was my big like wake up call, was like, this isn't normal though. And when we realize it's not normal, then we know there's something we can do about it. And really, just accepting all of these symptoms is the big problem. I hate the poison pad commercials because they just really glamorize this use of pads for, yeah, let's be honest, no one wants to look like they peed themselves. And if they're leaking that much, they're probably using pads, and that's great. But for that to be the solution, it literally is just a band-aid, right? Like we're not looking at what's really going on and why we're leaking. And so, yeah, leaking is a big one. And any issues around eliminating urine. So, difficulty initiating your urine, difficulty fully emptying, feeling like you're not fully emptying, urgency around urination. You feel that intense urge and you don't have the time to make it to the bathroom. Maybe you have that actual urge incontinence, which is leaking on the way to the bathroom, those few dribbles as soon as you open the bathroom door, pulling down your pants. Like that's still not normal. We need to have that control until we decide to let everything go. And then on the same side with stool, so being constipated is a big sign of pelvic floor dysfunction. Difficulty initiating, so constipation, feeling like you're not fully emptying, or loss of stool. Those are the big red flags. Like you might have a little urinary leaking, but once people start leaking stool, they get real freaked out. And unfortunately, the urine was the first sign. And if we're ignoring that, it usually gets worse. And now we see sphincteric control issues at the rectum. And so we do want to avoid that. But even passing of gas, if that's involuntary, that's a sign. Pain with sex is a big one. And again, this could be pain on initiating penetration. This could be pain, deep pain in different positions. This could be pain around arousal. This could be pain around orgasm, after orgasm. Anything around intercourse that's uncomfortable is not normal. And there are a lot of things that can contribute to that and cause that. And so it is definitely something you want to get further looked into. And then those are really, pain things, pain with sitting, tailbone pain, like obvious pelvic pain issues. But even things like frequency, going to the bathroom all the time, just going pee all the time is a sign that there's something wrong. And these are little signs that we're just like, oh, yeah, I just peed 30 minutes ago, and we go pee and we think it's silly. Like, why am I peeing again? Or you feel this big urge and you go and you're like, what? That's it? These are signs that there's something going wrong. And we want to figure out what it is, because it is not as simple as weakness and pelvic floor Kegels or strengthening, because that's where we can actually cause a lot of problems if we just go straight into strengthening. But then, as I mentioned before, having that muscular connection in that pelvic girdle all the way to the tailbone and up into the hips is where we can see things like back pain with pelvic floor dysfunction very commonly, especially postpartum. And hip pain can be a big one for pelvic floor dysfunction. Again, tailbone pain, but even jaw. So, jaw is one of the big connections, and this is
That's
to do with the
amazing.
fascia, isn't it? So, we were just talking about fascia on the interview we did with you on my show. We got deep into fascia, and that is that TMJ connection. So, the jaw has a direct system tie to the pelvic floor space. And when you clench your jaw, it pulls on the pelvic bowl. And so, vice versa, you can clench your pelvic bowl and you'll find yourself kind of clenching your teeth. And we can also see this connection with our diaphragm and our vocal cords, because your pelvic floor is like a diaphragm. And then at the roof of your core, and so hopefully, if you are aware of real anatomy of your core, your pelvic floor is part of that core. So most people just think abs when they think core, but really it's a system, right? It's this system and canister of muscles that need to stabilize your spine, your pelvis, your rib cage, support your internal organs, but also manage pressure. And if we're not managing pressure well in this closed system, that's when we see a lot of issues. And so breathing, because the diaphragm is the roof of that core system, the breath work is the key to all of the things healing with the pelvic floor. And then if we think about the vocal cords as this diaphragm directly above the actual diaphragm and pelvic floor piece, it's these three diaphragm muscles that stack on top of each other. And so even things like your voice sounds and how you use your vocal cords can change the tone in your pelvic floor. And we've used these strategies for generations when we're teaching pushing for birth, right? Like, this is why there's all those whoa, like really deep growling sounds when we're going through birth prep. And it's because this lower hum, you'll feel it. You immediately open that pelvic floor. And if you go, you can feel it tighten, like you'll feel your booty hole kind of tighten and pull up. And that's that piece of just tapping into your vocal cords. And so using all of these other pieces, even how your feet, plantar fasciitis is a big sign of pelvic floor dysfunction, because if you're not absorbing shock well at your feet, that force is going straight up at the top, and your pelvic floor might be either getting worse because of plantar fasciitis, or your plantar fasciitis is getting worse because your pelvic floor isn't supporting your hip well. So this is a full body piece. And so that's why I'm a big advocate for treating that whole body connection and finding the root cause, because no, Kegels are usually actually not the answer.
Wow. For you listening, I don't know if you were clenching your jaw as she was talking.
Yeah, can
I'm
you
like,
feel
holy
it?
crap. Okay. So we can't talk about all this and not talk about all the surgeries and C-sections, hysterectomies, like all the things that can happen to us that obviously, especially if you're cutting through the abdominal wall or, giving birth, we've got some literal physical trauma that's happening to this part of your body. So let's talk about that a little bit. This is more common in people with fibromyalgia than women without. I apologize. I don't have that exact statistic in front of me. I just saw it go across a week or two ago, a more recent study about this. But let's talk a little bit about those abdominal surgeries, how that affects things. How do we recover from it and all of that?
Yeah, no, and it's one of those things that I'm a big advocate for. Well, advocating for yourself, and also in my community, trying to change the standard of care, because no C-section. I haven't had one C-section patient or someone that went through a C-section get referred to me. right? So there is such a disconnect in the orthopedic world and surgical world and gynecology world where, an orthopedist is cutting into a hip, a knee, ankle. They're sending you to PT 2 to 3 times a week for 6 to 8 weeks. But in gynecology, you're pushing out a baby. They might even be cutting you with an episiotomy. You might even get a C-section where they are cutting through 7 layers of connective tissue and nerve tissue and all of these different structures in the body, or with a hysterectomy or an appendectomy or a gallbladder or laparoscopic. Like there's so many of these little just, oh, let's just go in and see, or let's just cut it open, tie it back together, you're all good. Like, and it's so sad because these are muscles. So how do we expect the body to all of a sudden be able to function optimally after cutting into it when you can't expect after an ACL repair your quad to turn on? PT is going on in day one after an ACL repair and getting that person to turn their quads on. Like we have to reconnect. And unfortunately, that is just not happening in the women's health and especially abdominal procedure world, pelvic and abdomen procedures. Now, if you're getting a back surgery, they're referring you to PT. What is the difference here? Is it that there's a joint there? I don't know. I don't understand why in their brains it's like, refer for this, but not for this. And it's just such a disservice because then I do get women after C-sections 6 months, 6 years later, wondering why their C-section scar still hurts, why there's this shelf there. And it's like, well, if I would have seen you in the first 12 weeks, that wouldn't be there anymore. Like we could have fixed that and gotten that fascia and the skin and the fat to all glide and work together. But when we're cutting through stuff and then just letting it heal on its own, we're not directing the body where to put that scar tissue down, how to align those scar tissue fibers, how flexible should they be? How tight should they be? When you're just letting the body do its thing, it's at the whim of what you're doing. So if you're sitting, which normally after a procedure, you're resting, you're hanging out, and then everything gets tethered and tight. And again, fascia is this one connective sheath through our whole body, and it's one of the biggest things that gets totally destroyed when we cut into it. And then if we get these scar tissue adhesions with the healing, which is normal, scar tissue is going to get laid down when things are cut into. But if you're not helping the fascia align those scar tissue fibers, not only are they going to become really stiff within its own system, they're going to start to stick to all the other layers. So that's where we get these adhesions and really sticky tissue that doesn't want to move, why we see the C shelf after a C-section. But I think that it's way too written off after like a hysterectomy or a laparoscopic procedure or C-section, where it's like we should be rehabbing that core system and turning things back on for the sake of just getting the nervous system to know how to turn those muscles back on. And advocating for that care is crucial because, again, your provider is probably not going to tell you to do that. And so advocating for, again, PT, because they treat abdomen, but I will say if you're seeing a good pelvic PT, they're looking at that pelvic girdle and everything above and below. And so we can help identify both internal fascial restrictions, especially if you had internal tearing from delivery, and maybe you had an old LEAP procedure, an old DNC, or maybe you had an old laparoscopic abdominal procedure that now when I'm working internally on your episiotomy scar, those are tugging together and we can actually feel those tug. And so it's really helpful to have someone that is both internal and external at the same time to kind of help address all of those fascial restrictions. But I do think that's something that is so worth advocating for, even if you're not having an abdominal procedure. Again, delivery is trauma. Even if you had a little tearing or no tearing, delivery is trauma. Whether it was the most beautiful experience in your brain or not, your body's going to be like, what the heck did we just go through? And
Right.
more often than not, internally, the body is like tight as a rock. Most people think postpartum, their pelvic floor is like blown open and completely relaxed. But in fact, it's usually locked up because it's like, whew, we need to protect and guard. And what the heck was that? And then again, we get into that story of holding memory and trauma in the body. And sometimes after procedures like hysterectomy or C-section, or even a laparoscopic thing could be where all of a sudden now you are having pain with intercourse. Now you are having tailbone pain. And some of that could be physical restrictions, and other parts of it could actually be the emotional and nervous system stress that your body is physically holding on to. And that is one of the things that I like. I felt this externally, you feel a muscle melt under your thumb when you're working on some tissue, but internally, it is pretty crazy how much muscle or how much stress and emotion and memory and trauma that the pelvic bowl itself holds. I think that this muscle holds a lot of that more than others for a lot of reasons, but there is a very obvious autonomic nervous system connection in this space with all of the organs there and all of the autonomic functions there, that I think that is a big physical reason. But I think this being like the womb and the bringer of life for women is also a big reason why we store a lot of this trauma there. And so it is pretty crazy internally to feel that melt away. And sometimes it comes with crying on the table. Sometimes it comes with shaking. Sometimes it comes with someone saying, I don't know why I just thought of this. And then they'll bring up a random thought of their childhood. And as they're talking about it, their muscle goes, oh, and it just fully melts away. And it is pretty crazy, but it is really, really crucial to kind of tap through some of these emotional blocks that we're holding on to, especially if you've done all of the quote unquote body work and you're stretching, you're maybe even doing internal work, but you have to be in tune to your body. You have to be in your body when you're doing this work. Because I think that that's the other tricky part is a lot of women, we like to just check off the tasks. We've got a lot of to-dos. We just got to run through it. She said, I need to do some breath work. She said, I need to use this pelvic wand. So fine, I'm just going to sit here with my pelvic wand, do some breathing, think about what I'm going to do next. And that's not going to get you where you want to be, because really we need to have the awareness of, where am I? Where is this pressure? Where is my breath going? Is this space expanding? How does it feel? How is the rest of my body responding to this sensation? Is my body curling off of it, even though it's not that tender? Like that's where, women will cry and I'm like, oh, is it too much pressure? And they're like, no, it doesn't hurt at all. I don't know why I'm crying. And that's the body releasing trauma. And sometimes it's as simple as a big right? And this body just releases this emotional energy that was stored, and I feel the muscle melt. You don't always have to know what that trauma was, right? But you do need to feel it. You can't ignore it. If you're just like, oh, something's there, I'm just going to think about something else or move off or do something else, then you missed an opportunity. You really missed an opportunity to help release a lot of that trauma that your body is storing. And again, this could be as obvious as physical, sexual trauma. This could be childhood parenting trauma. This could be cultural trauma. This could be eating too much junk and your gut is holding trauma. This could be not sleeping well trauma. Like this could be a lot of different kinds of things. Your body doesn't necessarily know stress from different types of stress. Now, there are certain things that your body will be like, oh, that was real intense versus other things, but it's not saying, even exercise is a stress. And so for some people, even that exercise, especially in, the fibro community, a lot of you probably relate to that, where you are feeling okay and you go to exercise and your body's acting like you just went through World War II. And it's like holding on to all of this trauma and pain. And it's like, why? I just was trying to work out. But for you, that amount of exercise was too much stress, depending on how your body could handle it that day. So I think just honoring that space and being aware of the emotions that come up and just the physical restrictions, I think that's that first layer. Like there is a physical connection to these muscles and this tissue. So why are we cutting into it and expecting everything to heal normally? And sometimes that's the trauma. Women will come to me and that's the trauma, was that they did get cut into and no one did anything about it. And as we start working through that, the tissue stops hurting, that starts to melt and open up because they don't feel like they were just butchered. It's like, oh, you're paying attention to me, you're healing me, you're giving me this time and energy. And that's really all our body wants. And if you don't listen, it'll start to yell at you with pain and symptoms.
That's right. That's right. When you were talking about getting everything going the right direction and all of that, I was like, if you broke your leg and you didn't go to a doctor to like set it properly and have the cast and all the things, like that's going to be a mess when it heals, right? And it's the exact same thing.
It really is.
It's just kind of amazing. Now, I don't want to go too far down this road, but I think so much of this is because it's women.
Yep. It is. Unfortunately, it is. And that is, I hate to say, a big reason why I was kind of like, sorry, the men can fend for themselves.
We need to have something that's ours.
Yeah. Well, and I'll tell you, I will admit, I think men, when it comes to pelvic floor, men are underserved because that is where they are like, we're talking pelvic floor, we're talking women most of the time. And so there are men that are like, wait, what? Like, I can get help with erectile dysfunction. I can get help with like urgency. And there are a lot of things that men need that for. But because of just our cultural, like pushing women off and putting them under a rug and just saying, go drink some wine, you will be okay. Like this kind of stuff just fueled me to be like, no, I'm here for the women.
Yes, I can totally relate to that. Fibromyalgia is kind of the same thing. Now, most people are going to be hearing this after the fact, right? Like most people are not hearing this episode and then they're going to have a hysterectomy tomorrow and then can follow all the directions properly. So, what should we do then, I guess? If we've been in that situation, we've had some kind of a surgery, trauma, whatever, and then never were referred, nothing was fixed. Like, what should that person do to kind of help get that straightened out?
Well, I think the first thing would be reach out to a pelvic floor PT, like find some support because it can be very challenging trying to navigate this on your own, especially if you're years out. But I will also say once postpartum, always postpartum. And with that being said, once post surgical, always post surgical until you've gone through to restore that system. Because postpartum, especially, and even with just post surgical, post operation, we get so much tension and guarding. And again, that pain causes compensations. It changes how you posture yourself, how you move. And so it can just be like where, again, I'm seeing women sometimes in their 50s, 60s because of incontinence or some back pain. And then we start to resolve things and break down the layers to identify, oh, this all kind of started when you had that laparoscopic procedure, or oh, this started after the baby. It started with a little leaking. We ignored it, a little back pain here and there, didn't attribute it to it. And now we're in debilitating states where we have to listen. And so I think just seeking that care, no matter how far out you are, is so helpful. But breath work is probably the first thing I would start doing, whether you are about to go into a surgery or a pregnancy or come out of one, or you just want to optimize your core and pelvic floor function. Breath work is the key. And I do have to harp on it just because I feel like breath work's kind of trendy right now. And we've all heard of breath work. And it's like, I think I have to harp on it too, because when I was learning about this, I had the thoughts in my head of like, okay, but like really, what is breath work going to do? Like, how much is it really going to help? Like, hey, am I going to feel calmer? Like, what is really happening here? And I didn't know a ton going into my first patient. And of course, she wasn't a simple leaking patient. She was chronic pain, hadn't had sex in 10 years. I had probably the hardest patient I've ever had my first session doing pelvic floor. And I was like, okay, we've got a lot of research to do. All I really know is this breathwork stuff. So we're going to teach that today and give her something to work on while I learn more in the background. I didn't even do an internal assessment yet because she was in so much pain. I was like, okay, we're going to go over the breath work. She did the breath work for a week and came back pain-free.
Oh my goodness.
That was enough for me to go, okay, this breath work really is magic.
Wow, that's
And
amazing.
And so really, and it really is for so many things. But if we look at the very anatomical part of our body, again, pelvic floor is this base bowl and the diaphragm is the roof. And to manage pressure, they need to work together. And a lot of times they don't. And we're either compressing those forces or pelvic floor is stiff and it's just depending on whatever pressures are being shoved against it. Or maybe we're not even using our diaphragm and it's all how the abs are engaging. We really need to make sure that whole canister is managing pressure equally because you could have a really strong pelvic floor, but be managing your pressure poorly and shoving down on it all day long and leak. Or you could have a weak pelvic floor and never leak because the pressure management is enough that the urethral sphincter can withhold that. And so we do really want to look at just the pressure of the system and how we're moving that. But then beyond that, the breath, literally because of the pressure coming down. So with that breath, and I know you guys listening can't really see, as you inhale, that pelvic floor should open. So the breath should go down into the pelvic bowl. On your inhale, you should feel pelvic floor expand or your rectum blossom open a little bit. These are things you can see and feel with a handheld mirror or feeling with your hand on the vulva. You should feel a little pressure come into that space when we inhale. Because when we inhale using our diaphragm, most of us are familiar with belly breathing, but I like to think about that canister like a balloon, because if you had a balloon and only one side expanded or the belly, we would see that and we'd be like, that's dysfunctional. But when we see belly breathing, we cheer it on. We're like, yay, you're getting your diaphragm to engage. Good job. But while it has a good idea, it's still not really getting the big picture because, yeah, we are now knowing your diaphragm's turning on, but we really want that pressure to go straight down into the pelvic bowl and then fill the rest of the canister. So the breath should be this bottom up fill, pelvic bowl, back, sides, belly, then the chest. And yes, we still want rib and chest expansion. We just don't want it to be the first space because then typically the rest of the breath can't go anywhere. The chest just kind of takes that pressure and then it's like, well, I have no more breath to get down there. But then the other reality is because of that pressure coming down, it's physically massaging tight muscles. So if you don't feel this breath, now those of you trying it, you're like, well, I've never felt my breath into my vagina. Like that has never happened. Most people now are going to go, what is she talking about? And that's because we've never connected there. Like we've never tried to get it there. And so it probably is tight, especially if you have any tightness signs like pain with sex, urgency, frequency, tailbone pain, any pain or urgency or frequency or UTI like symptoms, especially if those UTIs are testing negative. This is a big sign that your pelvic floor is tight and causing a lot of those UTI like symptoms. And so with that breath, you're going to feel the breath go whoop, and that pelvic floor is not going to move an inch because it's like, no, and the breath's not going to stay there and say, come on, little buddy, open up. And so that's where we do use things like pelvic wands internally with my finger when I'm working on patients to physically open that muscle up. But say you have back pain or pelvic pain, you can use that breath and that rhythmic pressure to physically massage from the inside out. So it can be very magical because we're also tapping into the nervous system and tapping into that parasympathetic system that really calms the body and calms the nervous system, releases muscle tone, and can really just help everything feel like it's in a safe place versus that shallow breathing where maybe you don't have pain, but because you're stressed all day and have a lot of anxiety, your pelvic floor is clenched because you're never getting that pressure management. And therefore, you will have higher pain because your body is in a state of stress. So it does go hand in hand, pain and stress, and especially with fibromyalgia, I think that this population is one we really want to take advantage of that breath work and nervous system down training, both for that down training of the nervous system, but also to help all of that fascia and tension in the muscles let go, because the breath is a very gentle, rhythmic way to move that core and pelvic floor system. And we know the fascia loves rhythm and repetitive motion. And so incorporating breath work can be so helpful for managing pain flares as a warm up, as a cool down, just feeling that expansion. Because it's pretty cool. I'll tell you at this point with my breath, I can say, why is my right butt cheek expanding half a second after my left butt cheek? And to me, that says, well, my right butt cheek must be tighter. So then I go in and I do some release work, or maybe you find your left side expands before your right side, right? Like we want to get this awareness in our body of what it should feel like so that when things aren't feeling the same, we can say, something's not quite right. Something might be tightening up over here. And you can get into that and stretch it before we start to have tension and tightness and pain and symptoms like that. So breath work would be the first thing I would do.
Excellent. Excellent. A good place to start. Now, I know you and I could talk for probably 3 or 4 more hours, which we
Yes.
don't have time for. And I know you need to run. So let's just wrap up with like, what is one thing you want to make sure that people take away from this? And how can people find you if they need your help?
Yeah. Well, first of all, thank you so much for having me. I appreciate the support of anybody trying to help spread awareness of pelvic floor because I was peeing myself for 6 years myself before I even knew that this was something that wasn't normal and that there was help for it. So I think just having your support helping me spread this is so amazing and I do appreciate it. And I think the one thing would be just knowing that these things are not normal and there are a lot of things we can do about them and that the breath work is going to be a lot more magic and healing that than you realize. And just starting there and trying to connect and really be in your body, feel where that breath is going, feel where it's not going. Because to me, that does tell more, right? If it's not going in these spaces that we feel like we should feel it, so pelvic bowl, your back, your sides, your belly, your chest, this whole trunk should expand like a balloon. And if you're like, I've never felt it in my sides, I've never felt it in my back, these are probably where your muscles are tight. And I bet if you go poking and prodding, they feel a little tight, they feel a little tender. And so using that breath to really bring that balance back into the system can go a long way. I was telling you before, I think it was when you were on my show that I was leaking all of a sudden and I thought it was strength. I just kind of went down this spiral of why am I leaking? I need to exercise more. And I was like punishing myself. And really, it was just that I had allergies and my pelvic floor was getting a beating and it was actually working out too much from all the sneezing and coughing. And just doing a little 5-minute breathwork session made that leaking gone and it hasn't been back. So it is, I think, a big reminder for all of us, especially women, that rest is productive and that breath work is so productive and we can do it in bed. So, yay.
Awesome.
And in terms of where to find me, I guess a good answer for that is I also have a podcast. So Pelvic Floor Core and More at the Balanced Momtality is my podcast. I'm in a little middle of a rebrand right now. And so the cover art is the Balanced Momtality, but we are kind of shifting to Pelvic Floor Core and More. Still holding on to the Balanced Momtality just because that is also my practice name here in Los Alamos, New Mexico, where I do treat patients in person and I also do virtual coaching worldwide. I did just launch an app called Pelvic Floor Core and More, which is a free app and it is on iTunes and Android, Google Play. So go download that app if you want to get my free masterclass in Pelvic Floor 101. You get access to that. You get access to some tracking features and there is a 12-week restore program in there that you can pay for if you want more guidance and getting more structure, walking through all that, where we do group coaching calls and all that kind of thing. But I will definitely make sure you have my website and all of that. But I would say the podcast is probably the best place to find me, and then the Pelvic Floor Core and More app.
Awesome. I know what I'm doing when I hang up. And for you listening, just stay tuned. I will have a little bit more information where you can get all this stuff. Today's show notes will be at fibromyalgiapodcast.com/162. So hang on, everybody. And thank you so much for being here.
Yes, thank you. So fun.
And that wraps up my conversation with Dr. Desiree Cassell, Doctor of Physical Therapy, specializing in women's pelvic health. Remember, we will have links to Dr. Desiree's podcast, app, and more in today's show notes. Just go to fibromyalgiapodcast.com/162. I also wanted to mention an older episode here on the Fibromyalgia Podcast. I interviewed Dr. Sheila Whiteman in episode 39 about her book, To Pee or Not to Pee, the guide for reducing and eliminating urinary incontinence. If you want to learn more about that, you can find the link to that episode titled Stop Your Bladder Leaks. You'll find that in today's show notes, or you can just search here in your podcast app. Now, you heard us mention that we did a podcast swap. That means I interviewed Dr. Desiree here, which you just heard, and she interviewed me for her show. I'll have a link to that in today's show notes. I also plan to share that episode here as a bonus once it's published, so you may or may not have heard that already. But if you are interested in hearing me be interviewed for a change to hear about my story and how I help people, then you can check out that bonus episode. Again, today's show notes can be found at fibromyalgiapodcast.com/162. And now I've got our listener shout outs for you. Today, I actually have two because they're about the same thing. Last month, May, was Fibromyalgia Awareness Month. And you have heard me talking here on the podcast many times about our community campaign to obtain governor proclamations from every state here in the U.S. If you missed that or you want to learn more, just go back and check out episode 159, Official Proclamations for Fibromyalgia Awareness with Melissa Swanson. Now, this is focusing primarily on the United States. One, because I live here. It's where I am. It's what I can do. But we do want to spread the love. We don't want to just cover the United States and make it all purple. We want to cover the globe. So not all countries have something like a governor's proclamation, but you might be able to get a mayor proclamation or something like that. And so if you're interested in learning how we might be able to help you do that, just reach out to us through the podcast website. So our listener shout outs today are about that effort. The first one here comes from Jeanette, who is one of our coaches in Switzerland. And she said, "You all are doing an amazing job in America. It's incredible to see how the map is coming together thanks to all the hard work from everyone involved. Let's keep spreading the purple and making our voices heard. Thank you for all your passion and effort." And then this is from Amanda, the breathing goddess. She's also the host of the Manders Mindset podcast. And she said this on Instagram. She said, "This makes my heart and soul so happy. Proud of the work that you're doing." Thank you so much for that and for all the other little comments that we have received over the last month. It really has been an encouragement to us because let me tell you, this is a lot of work and heartache. For us, not for you. We do all the hard work, so it's easy for you. But it really helps us to hear that this matters to you and that is encouraging to you. So thank you so much. And as I have said before, this is absolutely a community effort. One person cannot do all of this. And one of the big reasons is because a proclamation can only be requested by somebody who lives there in that state, in that city. If it's a mayor proclamation, it needs to be requested by a resident, which means one person just literally cannot do it. So this has been a labor of love from our entire fibromyalgia community. And there are just so many people and organizations who deserve recognition for this. And you will have seen other people, other organizations sharing their proclamations, which is amazing. So thanks to them, thanks to you, and well done, everyone. You know, I'm actually recording this episode before the end of May because I'm taking some very well-deserved time off at the end of the month. So I'm pre-recording this episode. More proclamations could come in, but it looks like our community has obtained governor's proclamation from well over 40 states so far this year, which means we're almost there. We almost have them all. So if you would like to be involved in our efforts, again, just reach out to us through our website at fibromyalgiapodcast.com and just look for the contact link in that main menu. And, you know, I also want to say, if we already have a governor proclamation for your state, we still need you. We, a lot of times, will end up in a situation where someone moves or they can't do the proclamation for other reasons. Like when I moved from Portland to Seattle, I used to do the Oregon one all the time, and now I can't because I live in Washington. So there is a need to have backup plans. Also, it can be a great opportunity for us to talk with our governors, talk with our mayors, whoever is giving the proclamation to tell them more about fibromyalgia. I know Ann Garner in South Dakota, one of our coaches, she was trying to organize having other people with fibromyalgia there when she picked up the proclamation, just to bring more visibility to awareness. So that's another example of why you might want to be on our list, even if we already have somebody doing your state. So please reach out to us. We would love everyone's help with this. So thank you for listening, for sharing your time with me today. And I'll just close with this. Pelvic floor health is important to all of us, men, women, fibromyalgia, not. We all have a pelvic floor. So if you know someone who needs to hear this message from Dr. Desiree, it is not only about fibromyalgia. She helps people with pelvic floor issues, again, fibro or not. So please share this episode with them, because we don't want to keep all this goodness to ourselves, right? So please share. And I'll see you back here next time. And that wraps up another episode of the Fibromyalgia Podcast. I'm your coach, Tami Stackelhaus. For daily doses of hope, inspiration, and practical advice, come hang out with me on Facebook. Visit facebook.com/fibrocoach to find my personal coaching page and connect with me directly. To find the show notes, additional resources, or to schedule a consultation with me or one of my coaches, visit fibromyalgiapodcast.com.